They're actually their own doctor and they know best. And they're enlisting me and my practice as a part of their team. So they're the captain of their ship. People know when they're not feeling well. You don't need to go to a doctor to know that. You know your body. So you know intuitively, I'm tired and this is not right.
Welcome to the Healing Reset. This is a health podcast aimed at providing hope in your body's ability to heal and maintain health. Contrary to modern day belief, you guys, today's belief, you are amazing. You are designed to heal and you're designed to stay well. Your body is made for balance. I'm Jess, your host. Today we have on Dr. Sood, a functional medicine doctor whose mission is to offer comprehensive quality health care that empowers you to live your best life. She commonly treats chronic fatigue and is here to provide education, tools, and hope in that struggle. Welcome to the show, Dr. Sood.
Thank you for having me.
Yeah, I'm super pumped to talk about this. It's very common. So let's get right to it. How do you differentiate chronic fatigue from someone like me with a newborn who's just tired? I'm in a tired season. Or a listener who says it's February, the sun's gone, I'm tired. How do you differentiate chronic fatigue in a tired season?
So generally speaking, the people who come to my practice, they have chronic fatigue. They can identify. I mean, if you have a newborn and a 2-year-old at home, obviously, you're running around, then we can identify that that's the reason. Maybe you don't have enough help or whatever it is. And, a lot of times people do feel, in the winter months, they feel a little bit more tired. But the clients that come to me have generally been feeling this way for a longer period of time. So for some people, it's been years and years and years. For some people, it's right around, for women, sometimes around the late 30s, early 40s. We can only differentiate it by, doing a discovery call, a consult to really get to know what is the cause of each person's fatigue, because it varies.
When you say years and years, let's say me, I've been tired for 6 months as an example. Would you start to say, that might be chronic fatigue? Or is it someone who calls in and says, I have 5 years under my belt. I've been tired, exhausted. It's hard for me to stay awake during the day. I overcaffeinate. I'm just drained and it's been just 5 years. Is there a length of time that's average for someone to start thinking through their own personal fatigue?
So again, it's circumstantial, right? If you're still struggling, if you have that newborn, you're still struggling, it could be just circumstantial, and at that time in your life. But generally speaking, I do testing, right? If it's been years, that's chronic fatigue. People know when they have chronic fatigue and when there's a reason, right? So I don't have an exact number. Like, it's not like 6 weeks you've had it, that's chronic fatigue. 5 weeks, it's not chronic fatigue. Like, every patient and every client is different. So I don't really have an exact definition. It just depends on the person.
I almost hear you saying, hey, patient, you have an intuition. Is this chronic fatigue? Look inside yourself. Is this seasonal? So for listeners out there, think through, are you just chronically tired? Are you drinking coffee throughout the day in order to have the energy to approach life? Use your intuition. Is that a good guide?
100%. So when patients, I actually call them clients, come to me, I tell them that they're actually their own doctor and they know best, and they're enlisting me and my practice as a part of their team. So they're the captain of their ship. People know when they're not feeling well. You don't need to go to a doctor to know that. You know your body. So intuitively, I'm tired and this is not right.
I loved this quote I read one time on chronic fatigue, and it said, our bodies can only generate so much energy per day. If we spend more than that amount of energy, we die. Which seems strong. Seems like a strong statement, but it's not saying we die right now, but you have this amount of energy. And if you spend it, we die. So in that case, our body has to learn how to reserve some of it. And so it's saying, why does that happen? Because our heart will run out of energy. Our brain runs out of energy. Our internal organs run out of energy. So it needs to start conserving energy. And so our brains can't allow us to spend more energy than what we generate. That equals chronic fatigue. Does that make sense to you?
Oh, 100%. We live in this go, go, go world. I mean, we're just on autopilot, waking up, doing things the way we're supposed to. I think for the most part, many of us don't take the time to, for self-care and to really just be in the present moment and take care of ourselves. It's just, that's how life has become for many of us.
Yeah, totally. If you had to put a percentage on people struggling with chronic fatigue, diagnosed and undiagnosed? What would you say?
So in my practice, I would say it's about probably around 70% of people come to me with this, diagnosis of chronic fatigue. And I'm sure that there's so many more people walking out there. I recently had a client who came to me for another reason. She just wanted to take care of herself, young 32-year-old. And after she did the whole program and we used all the tools, she didn't realize that she was chronic fatigued her whole life, actually, and that life could be so much better than what she had known it to be, which was, that was like a huge win for her.
That's amazing. It reminds me of, I didn't know I had a thyroid problem. And when I got diagnosed, I started taking thyroid medication, and I realized the whole time I didn't know that energy wasn't there until I had it. And my system was supported with what it needed at the time. And so by you just supporting what she needed, then all of a sudden she's like, man, I was tired, which is such a cool thing to be enlightened to the fact that I was living with this and my body wasn't where it should have been. It wasn't in balance. And now it is. And because they did your program with your tools, she got there.
Yep. Yep.
That's awesome. What is the average age range where someone starts the onset of chronic fatigue?
So that just varies. I mean, I've also had some people who are in college and they've come to me for some treatments because, they may have had an Epstein-Barr virus or they may have had chronic Lyme's. So I put them through an IV package that I have. And so their chronic fatigue started after an event, something happened. So I can have young people, but then I have a lot of women who are in their late 30s all the way into their early 50s who have chronic fatigue, who are coming into me as well.
Now, does it often start with something like a virus that we contract when we are younger, or is it mainly hormonal? What drives the tiredness?
So that's where when somebody comes to me, like for the young ones, the few that just recently came to me, I could pinpoint it after I do an extensive onboarding history that, okay, you had Epstein-Barr, it was diagnosed, and since then you've never been the same. So for them, it was the virus that was the event that caused this. But for a lot of other people who come into my practice, we have to do testing. And a lot of times it's multiple things that are contributing to the chronic fatigue. It's not just, so for those young ones, it might just be Epstein-Barr that caused it or triggered it. But for someone else, it might be like the food that they're eating, the hormones, and all these changes that are going on in their body. So we have to test, we have to do the history, and then each person is individual. It's not just like one reason or one cause, and the ages vary. They really do. But
oftentimes we want it to just be a blanket. Hey, you are fatigued. You're chronically fatigued. Do this and you will get better. And it's just not that easy. We're so individual as humans and our fingerprints are individual. And that's where it's just like, why is this happening? So it could be the virus. It could be hormones. There's so many contributors is what I'm hearing you say. It's hard to really pinpoint one unless you're unless you're young, but that's not right.
No, because some young people come in and they didn't have a virus and they're fatigued because it's the lifestyle choices that they're making, which food is one of the most important. So it doesn't have to be a virus. It could just, there's so many different things that can cause it. And sometimes, and oftentimes, there's a lot of different things contributing to it. And it's just not one cause.
So guys, if you're out there listening, you're feeling fatigued, we're going to address that. We talked about food. What playbook can a listener say, all right, I want to go to a functional medicine doctor. I want to walk beside someone on my team like you, Dr. Sood. What am I going to walk into? What should I expect? What's your playbook?
So first I do a discovery call, and that's just about 15 minutes to see if we're a right fit for each other. Because sometimes I'll get people who say, hey, listen, I just want the IVs. I just want this, but I'm not stopping eating the way I eat. I love my pizza. I love my pasta. And there's nothing wrong with pizza or pasta for some people, but some people don't do well with gluten, for example, or dairy. So I do the discovery call to get a feel for if we can work together. And then we schedule them into a consult where I really get to know them, from even when they were born, breastfed or were they not, antibiotics. I get to know their whole history.
Why does that matter?
Because a lot of people, if you notice, a lot of kids are super sensitive, right? To the peanuts or this or that. I think A lot has to do with your gut. And we need to know if kids have been on antibiotics, because that can really alter the gut lining. And a lot of kids are. They get a little infection and then the doctor puts them on antibiotics. We need to like fix the gut lining, because when the gut lining is broken or there's like holes in it, then that causes something called leaky gut. And it can cause a variety of issues, as we get older. And that's not for everyone. There's a time and place for antibiotics. I'm not saying that, but I think in general, we're over medicated and over medicating our kids, and it can cause issues in the future. So we have to really address all of that. And so I get to know the person, from the beginning, and then I put together a plan. Usually we have to hit it from several different angles, like the diet. We have to modify the diet. We have to, for a short period of time. Sometimes they may need IV therapies. They may need hormone replacement, but we test. I also test to see what it is that they need. So I listen to them and we test, and then I put together, a plan.
Okay. So diet, hormone replacements or hormone
not
therapies.
For everyone. Yeah. Not for everyone, but bioidentical hormones for some, women as they're going through perimenopause, late 30s onwards, can really benefit them.
And then IV therapy. What is IV therapy?
Yeah, so I do a lot of IV therapy. I've seen a lot of success, especially during this time, with the virus, where people come after they've contracted the virus and they're really, really tired. So I do IV ozone as well as UBI, ultraviolet blood irradiation therapies. And we do a series of them, followed by vitamin C. And I have, several cocktails that I have depending on the person.
What's a series? What should someone expect? Would it be a series of 3, or is this something that's ongoing for months until you reach a baseline?
So what I've seen is that generally one is not done. People can come in for one, they may or may not get the results. I think so what I have seen so far is usually I need them to do about 3 treatments in a short period of time. So it's not, again, if it's post-viral, it's not once a month for the next 3 months. It's like, let's get you in and do a few treatments within a week. Let's do 3 treatments within a week to really kind of knock out the residual problem.
Similar with chronic fatigue, 3 in a week?
No. So again, chronic fatigue, we're hitting it from every angle. So I might do 1 a week. It just depends on the person. You have to get testing done, test the kidneys, test the liver. We have to, every person is individual.
What I want people to hear, and listeners out there, I want you to hear that this is a program because you are unique and you're an individual. And so again, there's a discovery call, there's a consult, there's blood work, there's food research. It starts from when you were a baby and then it's programmed directly to you. And so in thinking of terms of a functional doctor and who to seek, who is going to walk this path and try to understand you from your specific and beautiful genetic sequence?
And it varies too. Like some people might do well with 3, some people might need 7, some people might need 10, and then do a maintenance or not. But I agree with you. Yeah, we have to look at every aspect. It's not just one and done, generally speaking.
How can you, in the most simple terms, explain ozone and UBI to a listener out there who's like, what? I'm not going to do IV therapy.
So basically, we puncture the vein, just as when you're getting your blood drawn, and we draw blood, and then we ozonate it. We add an O3 molecule, which highly oxygenates the blood. And it's just remarkable when you show the clients, they have blood in the bag. And when we put the ozone in and shake it up a little bit so that the oxygen combines with the red blood cells, it turns a bright red blood. It's like you just intuitively know this is healthy, oxygenated blood. And then we infuse it back into the clients. And the theory is that highly oxygenated body, the disease cannot thrive, when you have a lot of oxygen in your body and your red blood cells. And then I follow that usually with a vitamin drip. So I may do vitamin C up to 20,000, 25,000 milligrams.
Now, let me pause you there. You might have a listener out there that says, I take vitamin C orally. It's all good. I don't need that. But it's different.
Yes, it's very different. So there's pretty much 100% absorption when you give something IV. It's bypassing the gut. And you can also get much higher doses when you give vitamins through the IV, because there's only so much that you can tolerate taking oral. And also a lot of us are walking around with this leaky gut. We're not absorbing, some of the food that we're eating or even the vitamins, and then that becomes very expensive, right? We're taking all these vitamins, but we're not absorbing them. With an IV, it's going directly into your blood and it bypasses the gut.
Okay. So a lot of this starts in the gut. Really, we want to treat the gut. Now, what about UBI? We talked about ozone, vitamin C drip. What about UBI? How do you simply explain that to your patients?
So basically, after I ozonate the blood, then I run it through a special, it's called a cuvette, and it basically has so much surface area so that so we run the blood through the machine in the cuvette, and I want to say irradiates every single blood cell. So it kind of, the theory is it kills off viruses or bacteria, whatever you might have, as it's going back into the body. In fact, UV light has been a treatment of its own in other parts of the world for many, many years, just as ozone has been.
Mm-hmm.
Yeah. So basically, the aim is to make the blood an inhospitable environment for, things that don't belong there.
And my hope is that people will hear this over and over again and have a comfort around it. Mainstreamed is not, we're just not there yet in terms of mainstream for some of these therapies. And what a cool thing to have people say, I tried everything else. I got misdiagnosed. I got put on an antidepressant. I got put on anxiety medication. I got put on all of these things. Turns out it was chronic fatigue. I met with this awesome Dr. Sood who did these IV therapies to me, and my body healed itself. It got back into balance. But right now, there's no prescriptions being written in conventional medicine for UBI therapy, ozone therapy. And so what a cool thing to get out to this public of there's options out there that are non-conventional, but let's make them conventional.
Yeah. Yeah. And the thing is, when somebody has chronic fatigue, they may go to a doctor and they may just say it's in your head and, it's just normal. You know what I mean? You have 3 kids, it's normal, or you're depressed. They may just put you on an antidepressant. The best thing about going, or a good thing about going to an alternative or functional or naturopathic doctor or practitioner, is that we really dive deep to kind of find out what is the cause of your chronic fatigue. It could be a virus. It could be the food. It could be a parasite that you might have. It could be lack of, vitamins. There's just so many things that, and that's where we dive deep to kind of figure it out. So it's not that, like IV is going to just fix everything, but as a part of your package, it's very helpful. And it might just fix everything if the cause is such that the IV ozone and vitamin C will, fix that. So yeah.
What's really unique about you is you interview your patient just as much as your patient should be interviewing you, because if you're going to be able to partner with them to get them to health, we need to be the biggest contributors to our health. And we need to say, yeah, we're ready to actually maybe not eat pizza every night. Maybe we're ready to start adding in different foods into our diet, taking out different foods and trying to feel what our body needs to get back into that balance that we often talk about. What about someone who's not quite ready to go to the doctor, but this is triggering something in their mind of, I think I might be chronically fatigued? What's something that they can change at home to start maybe like 6 weeks of take this out of your diet or put this in or move this way? Speak to that person who's not ready to go have a discovery call with you, but they think they're chronically fatigued.
Believe it or not, first of all, it's hydration. I think that everyone needs to just increase up their hydration. We all do, because 70% of our body is water. 90% of our brain is made up of water. So I would say, and we've all heard this before, but really doing it is not easy, right? So increasing hydration. And there's so many diets out there. So which one is it? Is it gluten-free? Is it dairy-free? Is it vegan? Is it paleo? There's so many different diets out there, and every person is different. So I would recommend start with just adding more living foods. I think that's the one thing that we can all agree on with all the different diets out there, that just add more vegetables and fruits and living foods into your diet and see how that makes you feel. Because a lot of us are eating just too much, processed foods. So hydration, adding, vegetables and fruits and, living foods. And, then I would say I highly encourage you, to find a practitioner, nearby, and maybe they have online programs, or maybe they have, detoxes or seasonal detoxes, to maybe sign up for one of those to see, how it can help you before you jump into a discovery call with a practitioner or a consult, or, signing up, for a program.
All right. Just as a final question, what percentage of people turn their chronic fatigue around and see remission from it? Is it high?
If they do the work with the dietary changes and say they need hormones as well, and we hit it from all different angles and the IV therapies, so far, I have had probably a 98% where the fatigue is gone. Everyone feels, much, much better. But there's obviously a percentage of people where we then have to go and dig deeper, and do further testing to see, hey, is it mold that's causing it, the fatigue, or is it heavy metals? There's so much more. So you can never guarantee 100% because you just have to keep on going. That's the beauty of this type of medicine, is that we keep on going until we figure it out, because there is a reason. But I have great results. The people who do the work and they do the IVs if needed, and the diet and hormones, whatever they need, they get results.
You guys remember in the very beginning, her mission is comprehensive, quality, empowering to you. And that's where you get to play a role in this at 90% plus to heal your body. So if you're out there and you're tired, and that statement that I read resonates with you, your body can only generate so much energy a day. And if day after day, year after year, you're still struggling, reach out, seek a functional integrative practitioner who's going to look at you as an individual. There's so much hope for you out there. If you or someone you know is struggling with this, don't stop.
There's hope.
Thank you so much for coming on, Dr. Sood. It's great chatting with you.
Yep. Same here. Thank you.
This podcast is for informational purposes only. Statements and views expressed in this podcast are not medical advice and have not been evaluated by the FDA. Opinions of guests are their own, and this podcast does not endorse nor accept responsibility for statements made by guests.